demonstrating the test item clusters for neck pain that will benefit from thoracic manipulation. The first one is onset of less than 30 days, no symptoms distal to the shoulder, an FABQ activity score of less than 12, diminished thoracic kyphosis, extension does not aggravate symptoms, and cervical extension of less than 30 degrees. I will demonstrate the test item clusters for a full thickness rotator cuff tear. The first two we're going to do are the painful arc and the drop arm. So can I have you bring your arms up to the side? And then slow and controlled, bring them back down. The next one I'll do is the infraspinatus test. Have you put your arm like this. Don't let me push your arm in. So now I'll demonstrate the test item clusters for subacromial impingement. The first one again is going to be the painful arc. So you bring your arms up to the side. Okay. The next one is infraspinatus test. Don't let me push you in. And then the last one is Hawkins-Kennedy. So have her bring her arm up.
No.
Is that your pain?
Yes.
So now I'm going to demonstrate the test item clusters for mechanical neck pain that will benefit from cervical manipulation. The first one is that the patient believes that manipulation will help them. The next is that onset has been less than 38 days. And then if there's more than a 10-degree difference of side-to-side rotation, rotate to the right. Good. To the left. Good. And the last one is if they have pain with passive accessory motions. Is that painful?
Yes.
So now I'll demonstrate the test item clusters for cervical radiculopathy. The first one is ipsilateral cervical rotation of less than 60 degrees. You rotate your head to the right. Good. The next one is Sperling's. You look back. Rotate your head this way. Okay. The next one is distraction. Okay. And the last one is upper limb tension test. Tilt your head away. Does that make your symptoms better or worse?
Worse.
Tilt your head towards. Better or worse?
Better.
So now I'll demonstrate the upper limb tension test A for cervical radiculopathy. I'll be demonstrating the active compression test, which is to assess if there's an acromioclavicular lesion or a labral tear. So I'll have you put your arm up, in, with your thumb down. Don't let me push you down. Okay, and now with your thumb up. Don't let me push you down. So I'll be demonstrating the apprehension test, which is to test the integrity of the GH joint capsule and assess instability. I'll demonstrate the elbow extension test, which is to assess the presence of a fracture or joint effusion. So if I can have you take your arm out to the side and try to extend your elbow all the way. Okay. Demonstrating the Finkelstein test, which assesses the presence of tenosynovitis of the abductor pollicis longus and extensor pollicis brevis. Make a fist with your thumb inside. So I'll be demonstrating the difference between a full thickness rotator cuff tear and a C6 radiculopathy. So for the full thickness rotator cuff tear, you're going to have localized pain and weakness in the specific muscle that's torn. So for example, if the supraspinatus was torn, you would have weak initiation of abduction and weak external rotation, and those would be painful when contracting. For the C6 radiculopathy, you'll have diffused weakness in any muscle innervated from C6. So all the muscles of the rotator cuff, the elbow flexors, and wrist extensors. So biceps and brachioradialis. You will have a decreased sensation in the C6 dermatome, so right here. And and then you will also have a decreased C6 reflex for the brachioradialis. So the main differences are just with the rotator cuff tear, you're going to have weakness and pain, and then for radiculopathy, you'll have decreased sensation, decreased reflex, and diffuse weakness throughout the arm.